All right, good afternoon, everyone. Thank you so much if you are coming to attend our session. Thank you for that. If you're not, no worries. We won't get offended. My name is Saadia Akhtar, and I'm the Associate Dean of GME at Mount Sinai Beth Israel, and also part of the Icahn School of Medicine at Mount Sinai. I'm here with my lovely colleagues, who they will introduce themselves.
Hi, I'm Guy Carmelli from UMass. I'm one of the education faculty there.
Awesome. Hey guys, I'm Sreeja Natesan. I'm APD at Duke University. I'm also the co-chair of our Justice, Equity, Diversity, and Inclusion, so JEDI committee as well. So excited to have you guys here to talk about representation matters, and we'll really talk about why this matters in our presentations as well as our material. And there's a little bit of an echo just for our team if you're able to work on that. So we have no financial disclosures. There's no conflicts of interest. I'm actually going to come to you, if that sounds okay, just because I don't like to be lonely up front by myself. So we'll kind of go into it, but we're going to basically just lay a foundation of what representation means. And then after that, we'll talk about some of the barriers to this or what not to do. And then we'll definitely share some resources on how we can do this well in our material as well. So why does representation matter? So representation is when our students or learners are able to see themselves in that material and really imagine themselves, in that place doing that job or that field. And what they've actually found is that actually the reverse is true. So when our students do not see themselves in that material or in the author group or as the teacher of that class, they actually can envision themselves in that role. And this really, you can imagine, causes them not to be able to meet those goals, and they actually do poorer in those classes itself. So this is why representation is really key to kind of keep our students motivated. Really, if we could tie this into their lived experiences and invite them into the conversation to share their own diversity and their own cultural competency and sensitivities, this can really make a big difference for this. And I do want to mention that while we'll be talking about just representation in materials, this really is talking about increasing the diversity of your classes, also increasing the diversity of your teacher and faculty group as well. That you need all three of those to make this possible. So having beautiful slides will not be enough to just increase the representation for your learners. So where do we see a lack of representation? I have 4 children at home, and I would say that we've gone through many, many children's books, like hundreds of children's books in the last decade of their lives. And there's a lot of literature out there, especially in the non-medical setting, about the lack of representation. They actually say for children's book, only 10% of those books contain either Black, Indigenous, or people of color as the main characters of those stories, so which is quite drastic. And actually, for some of those ethnic groups is actually less than 1%. And then if we bring this into the textbook, that also the same thing is true. About 60 to 80% of the images used are actually European white pictures versus if we talk about our BIPOC population, it could be less than 1%. And then also for some of those populations, it's not even existing in our textbooks itself. And so this is where, thank you, representation really matters, because we know that representation actually really helps to increase the cultural climate and the culture and actually student outcomes as well. So it's really important to think about how we're constructing our didactics and really inviting diversity into the conversation as we're teaching. And so a lot of times when we think about diversity, we think about gender or race or ethnicity for that. But I would actually like to challenge all of us that there's so much more to diversity than just those categories. And we know a lot about this from implicit bias kind of training and research as well. And if you think back to SAEM and our conversations that we had, I wonder how many of us have seen a person with a disability on a slide, right? I would say I have not. Actually, if I think back to the last couple of decades, I don't know if I have. And especially someone with, showing someone with a disability in a power of strength or showing their talent as well, right? So this is where we can really, show this diversity in a lot of different ways. Also, age is another thing. The extremes of age, a lot of times we see this stereotype. We know there's a lot of bias around age as we see them portrayed in clinical scenarios. Similarly, obesity, there's so much literature out there about physicians' perceptions of patients with obesity, how they get poorer care. And a lot of times, our slides don't represent actually all the strengths that this group also has. And also just sharing about the, clinical considerations that we need to think. Similarly, for our LGBTQIA plus group, a lot of times, we see this group represented in a way that may not be the most favorable. Maybe it's tied to stereotypes instead. And so it's really important to think about how can we actually optimize the representation of this group in a positive way, and also when we're talking about it in a clinical aspect, to take our bias and our own stereotypes out of it. And so this is really important because our students are noticing this. A lot of times when they see a clinical scenario that brings up the demographics, a lot of them wince because that might be the only time they see themselves represented in that material is when it's associated with poorer outcomes for a certain population. And a lot of those poorer outcomes are actually tied to social determinants of health, not actually that population itself. And we'll talk a little bit more about that in the second half of our talk. So I would really challenge all of us to recognize that diversity really matters in our materials, and so we really need to be thoughtful. We can check our own biases by doing, for example, the IAT, the Harvard implicit bias test, to really check our own bias. And they have a lot of them, not just race and gender, but they have about weight. They have it on a whole lot of other aspects of a bias that can infiltrate. And this really is hurting our learners, I'll say, because if they don't feel like they belong, they're not going to be invited into the conversation to actually engage in that material. And the loss of inclusion actually has been shown to have a higher attrition rate for these students, and also even a higher rate of depression and mental health illness and so on. So there's a lot of repercussions for students not feeling like they're belonging. So we can really do this with our material. I'll also say that our generations of learner, they're all about social justice. They're growing up in the world now saying that representation does matter, and they are noticing when we're not talking about our populations correctly or when we're perpetuating stereotypes. So we really need to be thoughtful because our learners will hold us accountable for this as well. So just we'll talk a little bit about when adding this to the conversation matters, how you can do that, and we'll give you a couple resources as well.
Well, thank you all for coming and listening to our talk. I can tell you really care about improving your diversity within your lecture materials. I'm tasked with giving some specific examples of what you should not be doing in the lecture to kind of improve what was just talked about under Sree's talk. So these are the 4 things we'll discuss. The first is the low-hanging fruit. If you want to improve diversity, you need to include that in your slides. And you want to also be careful about how you portray certain individuals. So let's say if you always show a doctor slide with a white male physician, or conversely, when you're talking about support or ancillary staff, you always include a female nurse. That could be going against improving equity and diversity within your slides. So it may be just out of convenience, because you can see I typed in Google what comes up on the first slide, but it could take just scrolling for a few pages, or Saadia is going to talk about some different websites that you can find more inclusive content. So maybe images like this where you have a minority physician and white male nurses could be better. Be careful about when you talk about certain concepts like teamwork, and we always use this image where we have all the hands in the middle and it's typically a white male hand on top. That could send a subliminal message. Rather, you can look for an image where there may be nobody on top and it's all kind of equitable. There are certain medical topics that Sree kind of mentioned that's prime for causing issues, such as in dermatology. There was a study that showed that 47% of dermatologists feel ill-prepared to diagnose certain conditions in non-white skin. And that's typically because there's a disproportionate number of clinical images that only represent white skin in textbooks. So you can see here I typed psoriasis in Google, and you can tell what kind of images came up. I did the same thing for urticaria and eczema and got the same results. The next point is to be careful not to include diversity in a biased manner. So Sri kind of mentioned this, and I'm giving a specific example. If the only time you include someone who's like Hispanic or an older female is to discuss a case of someone who is uninsured and has poor health literacy, then that kind of sends a message about how you view this type of demographic. Again, if you want to talk about homelessness and psychiatry, and this is the only image that you include of a black individual, that is also biased, because homelessness and psychiatric illness spans all races, genders, ages, and so we should be careful about how we include images. Sri also mentioned sexual orientation, and there's been a lot of stigma towards this and sexually transmitted diseases, and I don't think that anymore we need to link this to discussions of HIV. I mean, we could just discuss the illness as it stands without needing to mention sexual orientation. You can bias people without even discussing the individual. Oftentimes during presentation, we discuss, oh, the patient came from an outside hospital or rural area or community site, and we suggest that they got inferior care in that location because of where they come from. And so I think it's kind of unnecessary. I know I trained in Brooklyn, and you'd always hear, the Manhattan hospitals are superior, and I think that's a little unnecessary, especially in our lecture presentations. We don't have to mention that. The next point kind of goes off of what I just talked about. Sometimes we don't even need to mention someone's demographic. It might be unnecessary for the point we're trying to make. I remember in 2010 when I was a medical student on the surgery rounds, the old school attending physician pounded in my head that every presentation must include gender, age, demographics, race, sexual orientation, because that's the only way we can risk stratify them and be able to treat them. But I think this is kind of like an old school mentality that leads to bias in medicine. There's a lot of literature that shows that we do have implicit bias, and it does affect our medical care, so much so that it's even made it into the social understanding that this is occurring. And so how we can work on that is to try to remove unnecessary demographics from our presentations and our lectures if it's not a requirement. So for instance, in this case, do we need to mention that the lady is African in order to have a clinical conversation about sickle cell, or can we just focus on the sickle cell disease? We should be careful about attributing certain adjectives to a certain individual. So on Wednesday, I helped moderate a panel where we were discussing giving feedback to certain types of residents. And during the cases, I decided to remove information such as gender. So we had a case where it was like the cocky resident and the timid resident. And so instead of saying a cocky male or a timid female, just propagating stereotypes that aren't true, I just made it a specific resident without talking about stuff like gender. And then finally, we should be cognizant of the different learning styles that exist amongst our learners and be as inclusive as possible toward them. So some learners prefer to learn via auditory channels, some are more visual learners, and I feel like the pendulum has swung in our lectures where we're all pictures and maybe no text at all, and that might be making more trouble for those who learn by reading. There are also tactile learners who learn more by doing, and maybe we should alter up so that it's not all lectures, but some workshops or simulation just to be more inclusive. Be careful about the colors that you have in your presentations, because some people are not able to see all the colors and might not be able to understand the graphs and tables that you put up. And then finally, we should be careful with symbols and language, which could complicate things during our lecture. So while symbols like this might be easy to understand for some of us, others may have a little bit harder of a time to understand and interpret what you're saying. And during our lectures, we really want to reduce the extraneous load to make things as easy to understand as possible. Similarly, in medicine, we value having fancy, complex words to, designate certain conditions. And while that's fine during an oral presentation or on documentation, I think during a lecture, it's just easier to make it more easily digestible for our learner. And I'm going to pass it off to Saadia.
So thanks, Guy and Shree, for setting the stage. I just wanted to share some information with all of you about what actually can be done if you want to do this correctly. And again, just to reiterate, we have no incentive financial disclosures or anything of that nature. We don't prefer one website over the other. We just wanted to share the information with you. So obviously, we are teaching in an environment that is, in addition to the didactics, we have small group discussions, we have simulation, we have a lot of different other ways that we are educating our learners. And I just wanted to walk through a couple of different venues and also share with you some websites that you can use. So in a small group discussion, I think it's really important to understand that as an educator, you need to know who the learners are that are going to be in that small group and also the faculty that are going to be involved. In addition, when you are usually doing small group discussions, it may be case-based, and so going back to what Guy was talking about, having a diversified sort of representation of the cases that are being discussed in that small group discussion is really important. In addition, looking at the workshops, that you definitely have to understand that I think as a person who is of color, it's really interesting to see what other faculty are around and who also participates in the workshops that we sort of set up for our learners. And if you put some thought into it and do some advanced planning, you can actually make sure that it is a diversified faculty that is being represented in these workshops in addition to the learners and the cases that we were talking about. In regards to simulation, I think simulation has come a long way. Obviously, there are a lot of clinical scenarios that happen, but you can also teach a lot of soft skills in simulation, for example, like professionalism, conflict resolution, etc. All of those being, again, in a very diversified fashion. What's important to understand is in the simulation setting where it's clinical stuff that's going on, we can actually use mannequins that represent different skin tones, different ages, and body habitus, and I think that we don't really sometimes think about all the ways that you could have diversity in the simulation setting. So just to give you an example, this is one of the websites that specifically is catering to the needs of including different skin tones when you are working with a simulation kind of setting. Now sort of moving on to websites, I do want to share with you, so the current presentation that we're using, the actual format that we're using is from a website known as Presenter Media. And again, I have nothing as far as like financial incentive to say this, but personally, I thought that this would be a good thing for us to use for this particular talk because Presenter Media, it's a paid subscription, but it has a lot of different formats where on topics and different type of areas of interest, you can actually get like a template for your PowerPoint and utilize that. So for Presenter Media, for diversity, this is actually the template that came up, and I just wanted to share with you. These are some of the pictures and some of the formatting that you can include in your presentation. So things that are already set for you to utilize. And again, these are images of different type of diversity representation that can be included into your PowerPoint. So now sort of to move to websites, I also wanted to just share, I think it's hard to sort of sit there and figure out, okay, well, how do I include images in my lecture, for example, that represents diversity, equity, and inclusion? One of the biggest places I think that all of us go to is Dr. Google. So if you go to Google, you click images, and then you click Creative Commons, you will be able to get some free imaging. The other issue, though, is it has to be free because who wants to pay extra dollars? There are actually some great free websites that you can include diversity type of images, and I'm just going to go through a couple of those slides and then transition to the slides which actually represent paid subscriptions for images that represent diversity. So the next one is unsplash.com. This is actually a really great website. It has a lot of different imaging that represents like diversity, equity, inclusion type of images. And again, it's free. You just log on and you can select and do a search. The other website is Wikimedia Commons. And again, this is really for any kind of topic. Again, free images that can be obtained. Moving on to Picnoy. This is definitely, I think, another great resource where you just go on to picnoy.com and put in your search topic that you're looking for, and then you'll be able to get free imaging that you can include. The other one is PickWizard. Again, same system. You log on, you put in your search engine type of topic that you're looking for. You can say, diversity, equity, inclusion, whatever topic you want to include, and you'll be able to get some images from there. The next one is Pixabay. Again, these are all free. You put in the search word that you're looking for, and then you'll be able to identify those images. Nappy.com is another one, or nappy.co, I should say, is another one. And this is a great website specifically for diversity and having images of people of color. And again, this one is free. So now sort of transitioning to the ones that are paid subscription, obviously I think they'll have a lot more imaging there, but again, you do need to pay for it. So this is the website Stocksy. And again, I am not showing any images from that website because of the paid situation, but the other website is Diversity Images or diversityphotos.com, and you can again specifically get images that can be paid for to be included into your learning material. Another one is Create Her Stock, which I think is really important. Again, female, person of color, they have images there that can be included of a variety of different activities specifically towards the female of color. And then we have Black Illustrations. Again, it's a paid subscription. You pay for the images that you're looking for. There's also Shutterstock that I think we're all very familiar with. Again, lots of images there, but you do need to pay for those to be included into your lecture material. And then there is POCstock, which is peopleofcolorstock.com, which again, a lot of diversity type of imaging that can be included, but you do need to pay for that imaging. And then there's Megapixel. Megapixel is great for imagery and a lot of different type of scenarios that can be included. Again, this is a paid subscription that you would need to download for the images. You'll have to pay for that. And so in conclusion, we just wanted to keep on track with time and of course open it up for any questions, but we really do feel that it's important, and hopefully today we've sort of explained how it is important to include diversity, equity, and inclusion into your learning material, and to really appraise the information that you already have. Maybe the next time that you're preparing a lecture, a small group discussion, or a workshop or a simulation session, you can sort of reflect back on what you've learned today. And then hopefully with the websites that we've shared with you today, you can actually use some of those images to diversify your learning material. And so with that, we just wanted to share our email addresses. If anyone has any questions later on, please feel free to get in touch with us. And if there are any questions, we're happy to answer them. Thank you very much, everybody.